Good morning to everyone. I'm going to just read off the press release. It says, Representative Mable Thomas and women of Georgia to hold press conference to comment on maternal mortality study committee. State Representative Mable Thomas, along with women of Georgia General Assembly and health advocate, will hold a press conference today. In order to elevate the health care needs of women in Georgia, elected women of Georgia General Assembly will comment on the House Study Committee on Maternal Mortality created by House Resolution 589, which recently had its first meeting. I would like to give you, as the press, a little background information on it. I am Mable Thomas. I'm District 56. I'm a veteran legislator, and most of my work is in the field of healthcare. I'm the author of the first mandated benefit in the state of Georgia that requires insurance companies to pay for mammograms, Pap smear, and a prostate cancer test. I also gave all fire trucks in the state of Georgia first responders license. I also amended the rape shield bill that makes it harder for a woman's past sexual history to be brought into rape cases. And so I'm always on the lookout to be sure that women and families are represented and that we have the support services that we need. Now, I want to just look at this right here. Right here, the thing that you always hear stated is Georgia is number one for business. So we submit to you that not only Georgia should be number one for business, that we should not be number 50 in the issue of maternal mortality. We know we can do better, and we know that when you enrich families and you enrich women, if you enrich women, you enrich families. And so what we believe is that when we went to the first study committee, House Resolution 589, we were a little frustrated with how we saw it going in terms of the emphasis on so much emphasis on data and whether you should check the box if a person passes, rather than the fact that what we want to deal with is we know that the issues of our women, period, and black women specifically dying, we know it can be prevented, and it has to be a lot of more concern around it. In the background, the Legislative Black Caucus, we had a bill resolution, House Resolution 447, and we did not get a hearing on 447. Yet, eventually a resolution called House Resolution 589, which is a study committee, their bill did get a hearing, and when we looked at the persons who were the authors of the legislation, we knew clearly that this was going to be a bill that was going to pass. The bill had a medical doctor on it as the first signature. The second signature was the Republican caucus chair. I think the third signature was the chair of the Appropriations Committee. The fourth person on it was Jan Jones, who was the Speaker pro tem of the House of Representatives. And then it was an African-American woman from Patty Bentley from Fort Valley. Her name was signed on it. So when we looked at the dynamics of that particular legislation, we knew that that bill was going forward. So we made it our business, specifically Representative Park Cannon and myself, we made it our business to be at that hearing. Since we didn't get a hearing on our bill, we felt that it was important that we be at the hearing to talk about that bill. And what we said at that particular hearing is that we see that a dream team, because rarely do you see the chairman of the Appropriations, the Republican caucus, and the Speaker pro tem on the same, and a medical doctor on the same legislation. Come on in, Nasra. On the same legislation. So by us seeing that, we felt that we should go in and make sure that the composition of that particular legislation was in place. And so it was a 5-member committee, and I was able to go before the Health and Human Services Committee and amend that bill to include a minimum of 2 African-American women must serve on this particular committee. And so we don't believe necessarily we should have had to do that, but to be clear, we know that African-American women are 3 to 4 times more likely to die at childbirth than other women. And we knew that we had to have the African-American women legislators' voice in this particular hearing. And so we did get a minimum of 2. State Representative Carol Hughley, who has served on the Appropriations Subcommittee that many of the legislators have appeared before to get money put into the budget. We've had a big push in the last, I'll say, 3 to 4 years, a million or 2 million, making sure that money was in the budget. But one thing that I want to say just from the legislative end before I bring in community voices is that there was $500,000 put in the budget under a what we may call a pilot project with Morehouse School of Medicine, which happens to be in my district as well. And there have been meetings, or there will be meetings, continued meetings on with the Appropriations Committee. And right now, the $500,000 that was put in for Morehouse School of Medicine for maternal mortality is on the table to be taken out of the budget. So what we say, if you do trust women and trust black women, and you trust that this state is a great state in business, then surely we believe that that money should not be taken out of the budget, and that that should be a priority rather than something that you think could be on the chopping blocks. Now, mind you, that cannot happen before we go in session unless there's a special session. But the fact that we are in the crisis that we're in, and yet the Appropriations Committee and those in the leadership believe that it would be to their advantage to cut the budget on the backs of black and people of color and women in general, because it is not right. And we believe that at this point we are willing to be open to the work of the study committee, and we will be attending them. But we think that we should probably go to another step too, to make sure that we also hear the real voices of women and hear the real voices of the conditions as well as the stories, because we must tell our stories of what's going on in this field. And the only way you're going to do that, you have to go into the street. You have to go to where the people are so that you can get the information that is needed. So based upon that, we're having this press conference, and we don't want to, at this moment, give a total no confidence vote, as they say, on what happened on yesterday. But I do think that some of the community voices will come and sort of give us a little bit of how they felt when they came, because one thing that I know as a leader and one who's been over a study committee, that if you have a packed room with both black and white and women and men, then that somebody did some organizing. Somebody made sure, because a lot of times our voices are not at the table and we don't come to the state capitol. And so the fact that people came to the state capitol on yesterday because they wanted to give testimony. They wanted to hear their authentic voices heard. And the way that the agenda was set up, it did not allow that. And it did not seem to be a priority. I know that if that many people had come to speak on an issue, and I'm chairing a committee, I would at least put some time on the agenda for some authentic voices to be heard from the community, and not as much emphasis on whether or not you check this box at the death certificate level. We are for life. We are standing for the lives of our mothers, and we're standing for support in Georgia, because we can be at the top of the game. We don't have to be trying to use statistics to minimize the fact that we are in a crisis in the state of Georgia. All right. The first person I would have from the community to speak, as you may know, there's an organization called Black Mamas Matters Alliance, and they're a national group. But we have Angela Anina, how to pronounce your name? Aina, who's the interim director of the local Black Moms Matter Alliance. She will come to you in her own way, and then we'll have two additional speakers, and they will come in this order, and then we will have Nanette Glass, Center for Family Community Wellness, to come before us as well. And if Sister Song comes in the room, or anybody representing Sister Song, know that we will allow you to speak as well. Thank you very much. I am Mable Thomas.
Thank you so much, Representative. It is definitely an honor to be here, and thank you for the opportunity and giving us, for those of us that represent our multiple communities here in the state of Georgia, giving us the opportunity finally to speak up about this terrible, terrible crisis that we're going through in the United States, and more specifically here in the state of Georgia. My name is Angela Aina. I am the interim director of the Black Mamas Matter Alliance, We're a national alliance that's based here in the state of Georgia, specifically in Atlanta. We are made up of OBGYNs, public health professionals, researchers, midwives, doulas, community health workers, perinatal support workers, advocates, and artists. I specifically name all of those professions because of the fact that you need all of these people at the table to really address the crisis that we are experiencing in maternal health. And also, it is important that when we are trying to address maternal mortality, that it is a diverse group of professions that come together to really come and find solutions to specifically change how we do or how we provide health care in this nation. It's important for me to say that because it was so disheartening as not only as a person who's really trying to fight towards the end of maternal mortality as we are experiencing it in the United States, but also as an everyday citizen here in Atlanta, Georgia, who's very, very concerned about the fact that Black women in the state of Georgia are 3 to 4 times more likely to die from for pregnancy-related causes during childbirth. That is absolutely ridiculous in 2019. And I was expecting to come to this study committee to hear about ways in which the public health systems and the hospital systems here in the state of Georgia can be working better and can be improving on their systematic ways of providing care to our communities. Instead, we were bombarded with some very, very alarming questions around something as important and rigorous as data collection. There was questions about how the public health department gathers data, questions about how the federal government is gathering data, and also all for what seemed to be more so a focus on wanting to change the data, change the statistics so that the state of Georgia can look better. I have to say that, again, as a citizen of this great state, that is very disheartening knowing that we do have a maternal health crisis in the state of Georgia that needs to be addressed today. And when we have elected officials that's paid by taxpayer dollars who are more so focused on political bias and the way that the state of Georgia looks, and wanting to even go as far as potentially tamper the process in which public health data is collected, that is unethical. It is unethical. It is unethical. And everyday citizens of this state needs to know that. That is what we're dealing with. That people that we have elected into power are more concerned about how the state looks versus being focused on the solutions. Also, as some of the folks at the State Department of Public Health were presenting on the health disparity statistics, the response from the chairperson of this committee was that, oh, it seems like we're on par, that we are literally on par with the health disparities of the nation. I don't know about the rest of you, but for us, that is absolutely alarming and very, very disheartening that our state representatives will think that not addressing the terrible health disparity that we are experiencing in the state of Georgia is not important, or that for some reason, some sort of stereotypes is the reason why we have that disparity. That is absolutely ridiculous. We need to be doing better. I will definitely stand here and say that I'm representing a wonderful group of folks who are working day in and day out to provide the necessary care and services that Black women and families need, including in the great state of Georgia. We are doing that in our communities, and we definitely need more resources and more support poured back into our communities to really provide the programs and services that we need for our families to thrive before, during, and after pregnancy. What we don't need is for elected officials to make this a political issue, all for the sole purpose of making the state look better. The state of Georgia is a great state, and we have the folks in the state who are here to do the work. We just need our elected officials to please release the resources so that we can do the work and solve this crisis. Thank you.
Thank you so much. The next speaker that we will have will be Ms. Monica Simpson, who's Executive Director of Sister Song.
Greetings, everyone. My name is Monica Simpson. I am the Executive Director of Sister Song. We're the National Women of Color Reproductive Justice Collective. And we have been based here, right here, in Fulton County, in Atlanta, Georgia, for over 20 years now. And I know that you have heard so many powerful remarks from my comrades in this work, folks who are really absolutely dedicated to making sure that we solve this health crisis that we have with the rising rates of maternal mortality in the state of Georgia. And what I want to add to the conversation this morning that was unfortunately not lifted up in the conversation yesterday in the hearing was that we have been working within our communities, gathering their stories, listening to the folks on the ground in our communities since we first found out about these rates rising back in 2014. And what we have heard overwhelmingly from the folks who live, work, plan, do all of their lives in the state of Georgia is that unfortunately it didn't matter how much money they made. It did not matter what their socioeconomic status was, what their education level was, that unfortunately in this state, far too often, the way that Black women in particular are treated once they go into these places of care was absolutely subpar. They were actually not treated fairly, not given access in the ways that they deserved, and that is absolutely adding to this crisis and making it impossible for us to actually take hold of what's happening around maternal mortality to actually change that whole dynamic. What is real, good folks of Georgia, is that we do have a health crisis. One woman, one pregnant person that loses their life in childbirth is one too many. We heard that over and over from the chairperson of that committee yesterday. However, the solutions were not the focus of the conversation. The solutions were not the focus of the conversation. And what we are committed to as those of us who are working in this field of reproductive justice that asserts that we have the human right to have the children that we want in the ways that we want, to not have children if we so choose, and to prevent or end pregnancies without shame and with dignity, and to be able to parent our children in healthy and safe environments in this country. But it is our right, our human right, to be able to have healthy pregnancies and healthy outcomes. And that requires a state to be able to put the resources into the state necessary to be able to make that possible. We are not going to stop doing this work. We are committed to this work as birth workers, as midwives, as advocates, as activists, as those who want to make sure that Black mamas in this state are able to live healthy lives and to thrive. And what we need for this state to do is to listen to Black women, to trust Black women, to make sure that they are giving what we need to our community so that we are able to change this around. I stand here firm and in solidarity with my sisters and those who are committed to this work, because we will not stop until we make sure that this maternal mortality crisis is no longer a crisis, but that we are thriving in this state, and that we are no longer against a par of any other state, but that we are actually thriving. And I believe that Georgia has every opportunity to do that, and that requires everyone being on the page to make sure that that happens. Thank you so much for being here today, and thank you for listening.
All right. Our next speaker will be Nanette Glass for Center for Family Community Wellness, and I would like for her to come forward at this time.
Thank you, Representative Thomas, and thank you to all of my sisters for being here. I am Danette McLaurin Glass. I am representing the Center for Family and Community Wellness. We are a research, advocacy, and training organization, a regional organization with teams in North Carolina, South Carolina, Georgia, Alabama, Mississippi, Tennessee, Virginia, Maryland, and D.C. I stand representing several entities, in addition, several networks. But today, I stand before you as a Black woman, as a mother, as a grandmother, as a daughter, as a sister, and as a wife. Millions of dollars were spent last year and earlier this year regarding pro-life in the state of Georgia. We talked about how important it was that life be cherished and protected. It's appalling to me to sit in a committee meeting and data is the topic of the day and not the lives that have been lost. I'm challenged with that. So today we're just wanting to let the state of Georgia know that we listened and we heard. And today is the first of many responses. This is not the end. We are not here for any other reason but to let the millions of women, mothers, daughters, sisters, grandmothers know that we heard, we listened, and we are going to respond. So it's not necessary for me to go over anything else, but if we are truly a pro-life state, then the lives of women matter. Thank you.
Thank you. What I want to do, which I said I would do, is to make sure before we take questions that each person, if you represent an organization or yourself, or you're in a profession that deals with it, to speak your name, as they say your name.
I'm Tamara Stevens. I'm here representing the Handmaids Coalition of Georgia and No Safe Seats.
My name is Nasser Smith, and I represent the Midwives and the Doulas of Georgia.
I'm Jennifer Cobb. I'm in Women's Health and an Emory graduate student.
I'm Karina Edwards, and I'm a midwife and represent Bellies to Babies Foundation and the Perinatal Safe Spot for Georgia for the National Perinatal Task Force.
Again, I'm Monica Ray Simpson, Executive Director of Sister Song, and I'm also a trained doula.
Safira Sayas Yassine. I'm representing.
Y'all talk loud now. Talk loud. Just don't talk. Give you the outside voice. Come on. Make sure they get.
Sayas Yassine, representing the Community Midwives National Alliance. I'm also a doula and midwife apprentice.
I'm Angela Ina, Interim Director of the Black Mamas Matter Alliance. I'm also a public health professional and researcher.
Brianna Lipscomb, also with the Black Mamas Matter Alliance.
I'm Michelle Bennett, and I'm with SOE Agency.
I'm Michelle Pratt. I'm a nurse here in Georgia. I'm Priscilla Bycas. I'm a lobbyist for civil rights, and I work with SOE Agency.
Danette McLaurin Glass, President, the Center for Black Women's the President, the Center for Family and Community Wellness.
Sometimes we wear different hats, and so we all enter. You know what I mean? So I'm Able Mable Thomas, and I have sort of been one of the point people on this particular issue since I came back in 2012, trying to make sure that that black women's voices and black women's needs and resources are put into place in the budget. So I've been working on the budget side, as well as I spoke to you earlier about the legislation, but we end up still amending their legislation to make sure that we are in place. Our commitment is for better birth outcomes, and our commitment is to make sure that our authentic voices are heard, and that that this process, in terms of whether it's this study committee or not, that we will have our voices heard at the legislative level. We're not going to tell you everything we're going to do, but obviously we are going to have a strategic meeting so that we can bring some of the organization and regular lay folks together to see what approach and what should we do next. But we definitely will not. We will go to the hearings, but we will not let that be the only way that our voices are being heard. And so if you're under the sound of my voice, know we coming. And we are going to organize and make this an agenda item that's not on the back burner, not driven by a conversation of which box you check on the death certificate, but the fact that on life and our families, if you empower women, you empower families. And that's what our commitment is. I'll take any questions.
Can you all talk some about, whoever might want to
connections here between, you know, HB 481 and what y'all saw, you know, at the committee hearing yesterday? Is there, you know, do you see some sort of coordination in the, you know, among the pro-life, the anti-abortion side, or what do you think?
Okay, I'm gonna have someone from the community people speak, but one thing I want to say though is there is a definite correlation, you know, because we should be concerned about women's health from preconception throughout the whole process, and with Monica, Ms. Monica spoke about how this whole things of reproductive justice moved, and I guess I'll throw this in too. I am one of the 12 mothers of the reproductive justice movement that set the framework in the America. But not only was I am one of them, I was the person that at the June conference in 1994 that convened the 12 women, and that we coined a phrase that didn't exist in America. See, now you hear the word reproductive justice, but prior to 1994, the word justice and reproductive did not be in the same sense. It was reproductive rights, reproductive freedoms, it was everything. And we created a group called Women of African Descent for Reproductive Justice and set up that framework that Ms. Monica Simpson talked about. So it is all connected, and they are infringing on our rights in all ways possible. And what we are saying is we're not going to go along with it. And we are committed to better birth outcomes, and we are committed to life. So we're not willing to give the whole conversation of the word pro-life to them.
That's right.
They can be anti-abortion, but they're not necessarily no more pro-life than any of us. Is that right? All right. So thank you. So, is that enough, or y'all want to say something? That's it? Okay, good. All right, okay.
I looked around that room yesterday to see if there were any, because I had a conversation with a Georgia Right to Life lobbyist last year, and we talked about maternal mortality, and she said, "Oh, we're on the same team. Come down to the Capitol and fight alongside me." I want you to know, I was looking around that room yesterday, and I did not see any of those representatives and lobbyists that I saw fighting 481. They weren't at that hearing yesterday. They're all talk. They're not about life, they're about forced birth. That's it.
All right, here you go.
Yeah, I wanted to add something, excuse me, that I didn't share in my remarks. The Center for Disease Control has done several reports on this. But I wanted to share this one thing. Implicit bias and racism was listed as factors in maternal mortality, specifically of Black and brown women. And there's no way that I could leave here today without stating that. There's no way we can just look at data and not also look at other areas. We did talk, yesterday they did discuss social determinants of health. And as Monica shared earlier, I was very concerned with the direction they were taking the conversation regarding social determinants of health. Those of us that work in public health, we understand that. However, to bring up criminal backgrounds, crime-ridden neighborhoods, the fact that they were not receiving prenatal care, the women, and that bothered me. But what really challenged me, as I talked to my colleagues, is that in the state of Georgia, we don't think it's a necessity to have Medicaid expansion. So if we're going to talk about prenatal lack of access to services, but you're not allowing women to have those services, we have a challenge. And I just wanted to make sure that, thank you for allowing me to state that.
Medicaid expansion now. Andrew?
I do want to just quickly make a comment about the notion of the anti-abortion bill and its relation to maternal mortality. Definitely, there has been a number of studies, a number of work around the world, and even in the United States, that clearly shows that the more we restrict access to abortion, the more likely people are going to have very detrimental outcomes, especially when it comes to pregnancy-related outcomes. Those people that take science very seriously and that understand clinical practice very seriously knows that pregnancy can be very dangerous for some individuals, and those individuals and families may have to make that decision to terminate that pregnancy in order to save the person's life, and also for that person to be able to parent the children that they already have. So, definitely it is disheartening that those who consider themselves quote unquote pro-life are not really about life itself. They are actually pro-fetus, I will say. I don't even think that they're pro-birth, because if they were pro-birth, they would also be about addressing the problems that we have in our hospital systems around childbirth-related issues and problems. And so, really being about life is really defined in the reproductive justice framework, because we're about the whole life course of the individual person and their families and their community, and that is very important. And if we really do care about children and babies in the state of Georgia, we have to care about their parents. It's always interesting that we talk about babies, wanting to save babies, but part of saving babies is saving the parents and the moms. That when the community of women is thriving, the community thrives, the family thrives. We know that. And so I would also like to mention that it was also very disheartening to hear the chair of this committee talk about, she wants to see more men come into OBGYN practice, that she was very dismayed that it was so many women, and weirdly connected it or tried to associate that with the adverse maternal mortality rates in the state of Georgia. That was very weird to hear, especially when we know that with the field of OBGYNs, we actually need more diversity. We need more women to come into the practice. We need more women of color to come into the practice, and people who have a more holistic point of view. And one of the things that we should have been talking about as well yesterday is also how can we better uplift midwives in the state of Georgia, especially community midwives, and really connecting them with a lot of our systems of care, because we know that the more that you incorporate midwives into our systems of care, we have better outcomes. We have real data related to that in the state of Oregon and other states. So Georgia needs to get on par. If we're going to get on par with anything, we need to get on par with states that are doing things well and that are trying to, address this issue from a team-based approach, whereby we have our midwives, importantly our community midwives, our doulas, our community health workers, our perinatal support workers, and our nurses and our OBGYNs all working together to really address this issue.
Monica,
And-
say anything else?
Well, no, I was going to say, I think the other thing that, should I move? Oh,
Yeah.
okay, sorry. Microphones. So the other thing I want to lift up too, just to kind of continue on to what my comrade Angela was saying, was that, whenever we heard the comments from the chair saying more men and all of that, what we also need to talk about, which is also a factor in this, is how we need to talk about the system itself, right, of healthcare, and how the training of healthcare professionals, right, actually needs to be looked at and examined and decolonized, in my opinion. I think we need to also talk about the fact that it's very difficult for those folks who are moving into these positions, right, how they have to fight within that system themselves. A lot of the work that we do at Sister Song with our training work is to actually work with medical schools and to work with medical professionals who are actually needing to understand what implicit bias and all of that looks like in their work and the impact of that, and helping them understand the reproductive justice frame, which is about centering the most marginalized and looking at the human rights frame and talking about intersectionality, not just in theory, but what does that look like in practice, right? So I think that we have to also think about, like, what are the barriers for people of color in particular wanting to enter into this field, right? And what they have to encounter with this medical industrial complex that we have to ultimately have deeper discussions about, because they are a player when we look at the larger picture of what's happening around maternal mortality as well. Just wanted to say that.
Can y'all talk about if there's any consensus?
This will be the last question, only because they have been extremely detailed, so we'll go ahead. Okay.
Y'all touch on it a little bit.
Okay.
But I wonder if there's consensus on like the kinds of solutions that y'all would like to see pursued first, that y'all think would have the most impact on reducing the rate.
Invest in our communities.
Well, go ahead, Bridget.
I will say that the priority, okay, I would say that the priority should be investing in communities of color, investing in Black women-led organizations, investing in our community midwives organizations. You heard from them today. All of these organizations and all of these agencies and healthcare centers are doing the work now. We are doing the work now, and we need more investment into our organizations and our centers that are truly doing the work in partnership with communities.
Thank you so much for everybody for coming, and we will, as I say, more to come. All right? Thank you so much.